Shalom, shalom. First and foremost, I want to give all honor and glory to Yahweh, Bahashim, Yahushai, Bahashim, Rakakwadash. Double honors to the elders and apostles of Great Millstone, and peace and salutations to the elect of the nation of Israel. Starting off with the 144,000, which would be the ruling governing body in the kingdom of heaven, which would be all men, the 144,000. Right? You also have a lot of the elect here in America, the largest multitude of believers, which is a lot of the 1/3, which will be men, women, and children. They'll be saved. Right? 2/3 of our people will be destroyed here in America. Babylon the Great. You have a lot of rebels that are scattered abroad that will be destroyed. And you have a lot of the elect that are scattered abroad in different countries that will be saved. Of you 12 tribes, you Israelites, of who the world willingly and ignorantly calls so-called black, Hispanic, Native American, Puerto Rican, Dominican, Jamaican, Haitian, Guatemala, Panamanians, Cubans, right? You all are the Israelites, contrary to what the world wants to believe. I am your brother Yeremia, can get y'all with a quick lesson. So as y'all can see, I have an article pulled up from Fox News about this guy, Dr. Oz, which this dude, is to believe to be Edomite, which he used to have this shows called the Dr. Oz show. It wasn't like the Dr. Phil show really, because the Dr. Phil show was more so where these Babylonians would get on that show and bring their problems on, like if they have a messy marriage or their kids bad or some shit. It was kind of like a therapy show, the Dr. Phil show. But this dude, I believe, I didn't really grow up watching it, but I believe it was strictly medical based, like about, health and wellness and stuff like that. But nonetheless, this guy is the administrator for Medicaid and Medicare and all those things. But as y'all can see, the article, it says he touts investment in Medicaid. I'm trying to save this beautiful program. So yeah, it's CMS stands for Centers for Medicare and Medicaid Services. So administrator means like you the boss, you the chairman, head guy, the leader, right? But we know that if you've been paying attention to the news, brothers, you will know that they've been cutting people's Medicaid off and Medicare off due to tax cuts and them putting money elsewhere, like them investing into more border security because of the immigrants, which is a lie. But this is how Esau does, right? But as y'all can see, it says the Trump administration plans to invest more than $200 billion into Medicaid following the passage of the One Beautiful Bill. Let me see. Let me get right into it. This is the point. It says last week, the Trump administration announced it is launching a new program that will allow Americans to share personal health data and medical records across health systems and apps run by private tech companies, promising that this will make it easier to access health records and monitor wellness. Now, why is the government, the federal government, launching a new program so you can share your data and, track your health, right? So it can be easier for them, right? They gonna tell you, it's gonna be easier for you, but there's a bigger agenda, right? Now, as you can see, it says CMS, which is Center for Medicare and Medicaid, will be in charge of maintaining the system, right? And officials have said patients will need to opt in for sharing of their medical records and data, which will be kept secure. You see that? Now, we know this devil, man. Hey, let's get a scripture, man. Right? This is for you Israelites. We don't care about you regular, everyday Babylonians, right? Sirach 12 and 13. I clicked the wrong one. Sirach 12 and 13. It says, or 12 and 10, Salakia. Never trust thine enemy, for like his iron rusteth, so is his wickedness. You see, hey, just as iron takes a little while to rust, hey, so is this man Esau Edom, which the Edomites are who's the nation who looks like this man on the screen. Those are the Edomites. You know? The scriptures tell us to never trust him, no matter what. Right? Though he humbled himself, and that's what he's doing, telling you that, you know, it's going to be a great way to monitor your health and wellness. You already can track that. All you got to do is go to the doctor's office and get blood work done and, you know, do other tests. What type of system are you launching? You know? What type of program is going to be so much better than what the one you already got for the health system that's in place now? Right? Like I said, like I read in verse 11, though he humble himself, right, that's what he's doing, and go a crouching, yet take good heed of, beware of him. Right? Pay attention, Jake, you know, to what this man is trying to do. Right? And thou should be unto him as if thou hast wiped a looking glass, and then shalt thou know that his rust hath not been altogether wiped away. So at the end of the day, when you realize what this man is doing and how he's going about it, you're going to understand that he's not here to help you. He's not even here to help his own people. Right? He's duping these people, man. Right? And I'm going to get more into it and explain to y'all what I'm talking about. Brothers should know what I'm talking about. You know, the scriptures tell us never trust our enemy for a reason. Right? Remember what happened during the C19, the pandemic, of how they was telling you that the jabs was safe and effective, wearing masks was safe and effective. Right? And this is not concerning jabs per se, or, you know, jump shots, but it has something to do with health. And this man he's a liar. Right? Just because he's saying it's going to be good for you and quick and convenient and, you know, it's going to be better, you can't trust him. Right? Right? And this man, he wasn't a part of the federal government at first until Trump came into office. So, you know, we know that these elites, you know, they use these presidents and leaders and officials to go about their agenda and complete their plans. So this man is a part of a bigger agenda, right? So they basically telling you don't have no choice. It says they will need to opt in. So there's not going to be an option on being a part of this new program, this digital health ecosystem program. It's going to be mandatory, right? But what does it say? It says those officials said patients will benefit from a system that lets them quickly call up their own records without the hallmark difficulties, such as requiring the use of fax machines. Man, who even uses that anymore? It's 2025. You know, people don't really probably use that anymore to begin with. But like I said, it's all about convenience. It's all about, you know, making it sound good and buttering it up, right? That have prevented them from doing so in the past. It says we're going to have remarkable advances in how consumers can use their own records. And how is that? What's going to be so remarkable? Because if you go in hospitals and, you know, doctors' offices, they already, if you have a what do you call it, a PCP, you know, a cert for primary care provider, you know, most people probably have one of those, right? You know, they already got your records, right? But what's going to make it fast? It's going to be an international. It's going to be a international system, really. And then it's going to connect to the hospitals, because usually, say if you have to go to the hospital, it's going to include the hospitals, doctors' offices. So you're going to have that CHIP. That's what that's talking about, right? And I'm gonna go into it of how that's what they talking about. They're not going to tell you the chip. They're not going to say Revelation 13 and 6. They're not going to say that. They're not going to say the MOTB or the mark of the beast. They're not going to tell you that. The devil ain't going to tell you he's a devil, man. Let me see. Right. It says CMS already has troves of information on more than 140 million Americans who enroll in Medicare and Medicaid. Right? Earlier this month, the federal agency agreed to hand over its massive database, including home address, to deportation officials. So that caught my eye too. You know, if deportation officials are people who's in charge of deporting people, right? You know, why are you handing over people's database to them? Right? If they're in charge of deporting people and that's what they do, why do they have a database system for their health? They're going to a different country. You don't need their shit. It's all to track them and monitor them. You gotta keep track of their work, monitor, track. Right? It's all to have their CHIP. That's what system they're talking about. Right? And you got people that really believe in this man. Like these Edomites, man. You know, let me go to Psalms 49 and 11. These Edomites, they really believe in this man. It says their inward thought is that the houses should continue forever, and that their dwelling places to all generations, and they shall call the lands after their own names. You see that? That's how these Edomites think, man. Because they have control, they have power, they have influence over the earth right now, and they have the resources to do what they're doing. They don't think that they're gonna be stopped, and they've been doing it. So that's how they think, you know. And that's why they coming out with this new system. That's ultimately what this is, man. Like I said, you got to have eyes to see to know, you know, that this is really what this is all about. Why? Because why else do you have to have a whole new program, you know, that allows Americans? So it's going to affect everybody eventually, you know. So it stands for I already said the Center for Medicare and Medicaid Services, right? And you know, ultimately that MOTB, that CHIP, is gonna have your finances on it too. It's gonna have everything on there about you. You know, because like I said, they already know everything about us. You know, there's videos where, you know, this is kind of off topic, where, you know, Jake has said the FBI is watching us. We know that. Esau tracks everything we do. You don't think he knows about our health and what we like and what we don't like, and you know what's going on with Esau knows all that shit, man. So what type of why do you need a whole nother system to be brought in, right? Because they're bringing in their NWO and they're making it happen, right? That's why, you know, there's a bigger agenda behind it, man. You know, and they're using this word like beautiful program because it goes into the big beautiful bill, which that bill, you know, they cut a lot of people's Medicaid and Medicare off. But now all of a sudden, you're going to come with a solution on reinvesting it after you cut it off, and you're going to bring a whole new system in. Right? Out with the old and with the new. That's how this devil operates, man. Let me get 2 Corinthians. Let me see. Salakia. We're not ignorant of Satan's devices at all. We know what this devil is doing, man. Right? We know. We know and understand. So 2 Corinthians 2 and 11. It says, least Satan should get an advantage of us, for we are not ignorant of his devices. You see? So, you know, and this man, years back, this dude, Dr. Oz, he had a, like I said, I already said this already, he had a show where he was basically talking about basically he was talking about the chip. That's what he was talking about. And he was talking about how it's going to revolutionize and transform the healthcare industry. And now all of a sudden, he's in Trump's cabinet, and he's in the federal government, and they're bringing a new healthcare system. This ain't talking about nothing else, man. It's obvious, man. It's obvious. Right? It's obvious. Let me see if I can go back. Right? Let me see. Let me show y'all the video, right? Which is really hard to find, and it makes sense because we at that time, you know. Let me see. Let me see if I can show it to y'all real quick.
The latest breakthroughs. Turns out one of the biggest discoveries is actually this tiny. See how small that is? This little chip may be the next big thing, and it sounds like it's right from a sci-fi movie, but people all over the world are implanting these into their wrists. So I asked my producer, Dean, to find out more about this cutting-edge technology and what it could mean for your health.
Whether it's our smartphones, our watches, our fitness trackers, or our Bluetooth headphones, it's clear that...
Yeah, you already, all those things you can track your health with. You have these little Apple Watches, you got these tablets, you got scanners, you got all types of shit that can track your health already. So what else do you need? Right? This devil, he's Satan, man.
Technology is not just part of our lives, it's running them. It's how we buy things, watch things.
You're supposed to go to the Lord for your health, man. You know, we're supposed to use herbs, right? You know, the Lord will send you signs and you know, messages, you know, to tell you where your health is at. Like, you're gonna be feeling a certain way, body could be aching, might have a rash somewhere, you know, might have gained weight. There's different ways to track your health. You don't even need technology, right? You know if something's wrong with your body or not.
How we date, stay safe, even how we travel. Paul? Cool. We're so attracted to our devices that they're basically becoming a part of our bodies. But what if they really could become a part of our bodies? Well, guess what? They can. Meet the RFID microchip. This tiny chip, which can be implanted into your wrist, yes, I did say wrist, uses short-range radio frequency identification, similar to the tech used to track your pets or your phone. Once implanted in your body, it could identify you as you pass through the airport, open the door to your home. It could even be used to buy groceries at the supermarket. Now, your driver's license, passport, keys, and wallet are all inside your body, contained in something the size of a grain of rice. I know it might sound like sci-fi, but it's not. 10,000 people have already been chipped, and the number is growing.
Yeah, I don't know exactly how old that video is, but it's way more than that. It's millions of people already got it.
The possibilities are limitless, especially when it comes to your health. Imagine you're rushed to the hospital without any identification, but with just one scan of your chip, doctors know your name, date of birth, medical history, insurance, blood type, allergies, even the medication you're...
See that? That's what they about to start pushing, man. That's why he's in the position that he's in. Esau didn't put that man in that position for no goddamn reason. And hey, excuse my French, but that's why he's on the scene, and he's in cahoots with Trump, and he's one of his right hand men. That's why. And who else you got up there? You got it, your man Elon Musk. He's pushing these chips, right? He's pushing these programs and doing trials and all of which they been got these things ready. They just now telling the people that, you know, they doing trials. They been got these things ready. That's why he's pushing that new system, right? Look at how they packaged it. Oh, you can see your blood type, your allergies. You know all your medical history. You know what type of medication, and you can open the door and go to the grocery store with it. It can be used as your passport, right? This is that new program, that new digital ecosystem, digital health ecosystem that they pushing. That's what that's talking about. Like I said, they're not going to tell you that it's the mark of the beast or it's the C-hip. They're not going to tell you that it's the chip. They're not going to. He's Satan. You know, you Jakes need to wake up and smell the coffee, man. You know, he's not going to tell you that, right? And you know who else he's working with? Let me see. Dr. What's his name? Let me see. he held a conference with Robert F. Kennedy, right? And I did a lesson on this man a couple weeks ago. This man wants people to have a digital tracking device inside of their bodies, if I'm not mistaken, or I think it said digital wearable device. You know, I believe that's what it said. Let me type in his name, Robert Kennedy. Yep. Robert Kennedy Jr. wants wearable health tracking devices for all Americans within the next four years. You see that? So if that dude was pushing it to see him, and he said that's gonna be the next big thing, and now all of a sudden he's in the government, and they gonna make this program mandatory. It said for all Americans. What else is that talking about? It's plain and simple, right? And this man wants people to have health tracking devices, and Dr. Oz is over the Center for Medicare and Medicaid Services program. He's the administrator over it. They both pushing the same agenda, man. You know? Let me get this in Sirach real quick. Right? Sirach 39 and 24 says, as his ways are plain unto the holy, so are they stumbling blocks into the wicked. So, hey, if you can't understand this, man, yeah, you wicked. You know, that's just simply, you know, what it is. You know, the Lord didn't give you the eyes to see. But let me bring this out, you know, because we're blessed to understand what's going on. Let me see, where is that at? Matthew 13. In 16 it says, but blessed are your eyes, for they see, and your ears, for they hear. For verily I say unto you, that many prophets and righteous men, these words are read, these words were written and said by our Lord Yahweh, right? For many prophets and righteous men have desired to see those things which ye see, right? The end of the Esau's world coming to pass, and have not seen them, and, you know, and to hear those things which ye hear, and have not heard them, right? A lot of the prophets, the men of old, right, they had visions, right, of the end days, the times we in now, but they didn't fully understand what was going to happen. They didn't fully understand that, but now we have the understanding now through the spirit and power of Yahweh by Hashem Yahushai, right? And you know, and we're here to let you know, you know, Jake need to stop worrying about, you know, trying to get rich in Babylon, trying to be famous, trying to get the bag. That shit ain't gonna matter pretty soon, man. It don't matter already. You know, it don't matter. Right? You know? So, Jake, you're worried about the wrong thing. You know? We don't have time to be backtracking, man. Let me go back to that. And also, let me type in his name again. Also, right, they have this $50 billion application fund for these hospitals that are closing. There's more than 300 hospitals that's closing around Babylon. And they said it's mainly in rural areas, but it's due to them, you know, cutting people's Medicaid and Medicare and, you know, for these hospitals and all that, so they can't stay open. And a lot of these hospitals are probably old and all that, but the fact that they're able to offer a fund for it, and it's a fund for application, so these hospitals have to fill out an application to basically get that money and then be a part of the program to continue being open. Why can't you just give them the money without it? Because these niggas are the devil, man. That's why. You know, they gonna start doing it in September, putting out these application funds for these hospitals, right? But it says he said the money is designed to help with the workforce development, right-sizing the system, and using technology to provide things like telehealth that can change the world. What's about to change the world? Let's see him. But it ain't gonna be for the better, man. You know, when you take this man, see him, you fully integrate your mind with this man. You fully saying that's your God, right? It says, imagine if we could change the way we think about the delivery of health and make it more about getting people healthy. So, are you admitting that You wasn't helping people in the begin with. Now you want to help them? Yeah, get out of here. You the devil, right? You're the devil, man. You know, these people can't help you, right? And they're not here to help you. You know. Let me see this in Psalms real quick. Psalms 55 and 21. It says, the words of his mouth were smoother than butter, right? But what was in his heart? And in his mind, he wants to take you people out, especially you Israelites. We the main target, right? His words were softer than oil. Oh, it's going to help you. You'll be able to, do this and do that, man. Hey, don't believe nothing this devil say. Yet were there drawn swords, right? So you jakes that chase this, that trust in this, man, y'all gonna be ashamed at the end, man. Just because this devil, don't tell you it's the chip. That don't mean that ain't what it is, right? This is Isaiah 30 and verse 1. It says, "Woe to the rebellious children, said the Lord," talking about your Israelites, "that take counsel but not of me, and that cover what they cover but not of my spirit, that they may add sin to sin." Because each time you trust in this man and you don't seek Yahweh Shemel, and you add sin into sin. It says that walk to go down to Egypt, which Egypt is modern day America, and have not asked of my mouth, to strengthen themselves in the strength of Pharaoh, right? And you gotta think, a lot of these people that's paraplegic or disabled and paralyzed and all these different things, they been offering these C-hips to them, so they gonna take it easily. And people that's on Medicaid and Medicare, everybody ain't disabled, but a lot of them, they can't really do things that, for themselves like that. So they go after the weak first, and go after these old people and stuff. And and a lot of people they're dependent on America Babylon, so they're gonna take it. If they don't have nothing else, what are they gonna do? It says, "Therefore shall the strength of Pharaoh," which the modern day Pharaoh is these Edomites, man, "should be your shame, and trust in the shadow of Egypt in confusion." You see? So when this come to pass, you're going to know that the prophets warned you. Starting with the elders and apostles on down, they've been warning you. That this ultimately, this is that prophecy that they going to come to pass. Revelation 13 and 16, it says, "And he causeth all, both small and great." So no matter what position you are in, rich and poor, no matter your financial status, free and bond, to receive a mark, right? And that word mark is charagma, right? Which means an incision. Something's going to go inside of you, and your right hand and on their foreheads. And that no man might buy or sell, save they had the mark of the name of the beast and the number of his name. That's what that's talking about, man. So keep believing that this devil is here to help you. He's not here to help you, at all. Right? This devil ain't never helped you Israelites. And it says ecosystem, so it's supposed to be helpful for the whole planet, man. Remember, the earth was given to the hands of the wicked, and these people are the wicked. The fact that they even have to, who the fuck, who destabilizes their own health system and just to make a new one, and nothing was even, it wasn't that. I mean, it was bad, but they not trying to make shit better. These devils don't make sense in what they do. But hey, man, this devil's coming down with great wrath, and he's pushing his agenda, but he ain't gonna succeed. He's not gonna succeed. So I just want to do a quick video on this, man. Hey, trust in YASHAMIAHLA. Don't take that C-hip, man, no matter the circumstance or death, right? So all this video is edifying to the Lord's elect, the Lord's sheep. I want to give all honor and glory to Yahweh, Bahashim Yahushai, Bahashim Rakakwotash. Double honors to the elders and apostles, great millstone. Till next time, I want to say, Abba Shalom.